We've got the Professor of Public Health, Michael Baker, on the line, joining us now. Michael, can you tell us, how does this change things? What happens now?
Well, kia ora. Well, firstly, I think this has really illustrated very highly effective response to this case. And I think I really agree with the Director General. This is really exemplary management in this case. What this means is we are moving inexorably to the next phase of the pandemic response, and that is the containment or the stamp it out phase, where we start to see cases in New Zealand that need to be isolated, and all the other things that have been described, that is contact tracing and quarantining those contacts and observing them for a period to see if they're infected. So all those steps are now really happening.
In terms of that tracing, Ashley Bloomfield mentioned there those people in proximity, a particular proximity to this traveller on the plane. Why only the people sort of in the same row in the row in front and the row behind?
Well, I think there is a lot of research showing that transmission in that environment is very limited. For example, we actually did research in 2009 with influenza, which is behaving very similarly on that first flight into New Zealand, and we found the only transmission on that flight was within 2 rows of the affected person. So, and other people have found the same thing. So this is evidence-based public health.
The other thing mentioned there, that there were 2 negative tests before a third, slightly different test was taken. Can you put that in context for us?
Well, I think it does just show the importance of clinical judgment. And they're obviously very alert clinicians to this possibility, and they looked at the whole picture and they did more extensive testing. I agree. We hope that other clinicians, when they see cases that where it doesn't quite fit, a negative result doesn't fit the clinical picture, will persist. And I think that's a real credit to them.
Doesn't it raise some questions, though, if you can return 2 negative tests? Someone who is less vigilant about it could let someone with coronavirus back out into the community.
Yes, I think this is not the biggest problem. The biggest problem is actually people who have very few symptoms, so they don't even see a doctor, but they are infectious. And we know that the majority of people who are infected with this virus will have very mild symptoms. And so that is a big problem in terms of containment.
We have an extension to the travel ban now. It doesn't just apply to China, it applies to Iran as well. Did we move too late on that?
No, I don't think so. Arguably we possibly could have moved a bit sooner, but I think it was just a balancing act. And this is going to be an increasing challenge as the pandemic works its way around the globe. To actually manage the borders. The biggest problem with Iran is that their surveillance for this disease is very poor, and we know that. We've known that for a week or more, because the only cases we're seeing are people who are turning up with pneumonia and in many cases dying from it, and very few cases in the community. And that just doesn't make sense from what we know about the pyramid of disease, that there's only a small minority of cases get really sick, and there should be a big base of cases with mild illness who are still being detected. And when you see that pattern from Iran, it's a country that has very limited surveillance, probably limited test capacity, so they had a very large epidemic there before it was really being noticed. And so that's a warning sign that you need to be very vigilant about people travelling from that country. And we're going to see that pattern also, unfortunately, in many other low-income countries around the globe. They just don't have the resources to do surveillance and pick up cases in the community.
So do you see realistically more bans in respect of travel from those countries?
Well, I think that's going to be something that the Ministry of Health will keep monitoring what's happening internationally, and of course we'll see this process gradually extended.
What would you say to people in practical terms who are listening to this and they may be quite scared by the news today that someone has tested positive?
Well, at the moment it is really just business as usual across New Zealand. We're not looking at community transmission at all, as I think has been pointed out, and that situation could well continue for weeks ahead, but at a certain point it's going to become increasingly difficult to prevent widespread transmission in New Zealand, as it is across the whole globe. Hopefully we can delay that as long as possible, and we have to use this time for maximum preparation. And there are a whole lot of things that we can do, and that New Zealand is very fortunate to have the resources, to have a very highly coordinated public health system and excellent health services.
Really appreciate you joining us this evening. That is the Professor of Public Health, Michael Baker, who's with Otago University based in Wellington. And just to recap, the Ministry of Health has held a press conference confirming that an individual has tested positive for the Covid-19 virus. And joining me now in the studio is our health correspondent, Rowan Quinn. Rowan, so bring us up to date from what we've heard. What do we know about this person?
Well, I'll tell you about what we've known so far, and then there's some new stuff that's come out of this press conference. So they know they're in their 60s, they're a New Zealand citizen, and they are currently being treated in Auckland Hospital in a negative pressure room, which is one that stops the disease spreading. They have symptoms of the disease, and they came in on a flight on Wednesday, early Wednesday morning from Bali, from Iran, but via Bali. And their family members became concerned about them quite quickly, and according to Ashley Bloomfield there in the press conference, said their behaviour was exemplary. They did everything right. They called Healthline when they became worried about his symptoms, knowing that he'd come from Iran, and then Healthline told them to go to the hospital where he was admitted. So he didn't have a lot of contact from getting off the plane to getting to hospital. What we found out a little bit more in that press conference there was that health authorities are trying to contact the people who are sitting immediately around him on the plane. So these are the people that are in the same row and in the 2 rows on either side of him. And they will be contacted by health officials and asked to go into self-isolation. And they're saying anyone else on that flight, they can contact the Healthline if they become worried about their symptoms at all. We know that 3 members of this person's family are in isolation, and that it's possible that more will go into isolation, but the 3 that were immediately dealing with this person are in isolation. And we also know that as you mentioned, the travel ban is in place now for Iran. So no one who is not a New Zealand citizen can come into the country from Iran. But what Ashley Bloomfield was saying there, that anyone who's come into the country from Iran in the last 2 weeks should be putting themselves into self-isolation straight away.
Yeah, and the Health Minister put that in some context at his earlier press conference, where he said that there are about 5 to 6 individuals who arrive from Iran on a daily basis, so much smaller numbers, fewer people than what we're talking about when we're talking about China arrivals. Now, I found really interesting that there were 2 negative tests there before a 3rd positive test, and he provided us some more information, didn't he?
Yeah, he said that the first 2 were from the throat, but this patient was displaying symptoms of having a problem in the lungs, so they took a 3rd sample from their lungs, and then that's when it came back as positive.
So that was versus 2 original samples taken from the throat and nose that turned up negative. So clearly it's the diligence of the health workers who have picked this up.
And I think we know that the coronavirus does attack lungs. You know, if people have a serious case of it, then they end up with pneumonia. So, that's where the man was displaying, or the person was displaying their symptoms.
And in terms of our preparedness, what do we know about the resources that we've got on standby?
Well, we know that we've entered a new phase. So we were in the keep it out phase, and now this is terms that health officials use, and we're now in the stamp it out phase. So that means when something has arrived here, we don't want it to spread. And so in terms of that just changes the response in terms of getting anyone who has been in contact to report themselves to be very careful with isolation. The health minister there saying be careful with hand washing, be careful with cough safely.
Keep your basic health messages forefront of the mind. So as Rowan was saying, wash your hands and take on the cough etiquette. Don't cough over people. So we have heard tonight 1 confirmed case of coronavirus. The person is being treated in Auckland City Hospital. 3 members of their family are also being, isolated, and people who sat around that individual are also being contacted by health authorities.